Hello, this is Cassandra Vogel. I will be discussing shock index as a tool for identifying patients at increased risk for postpartum hemorrhage during labor. The rate of maternal mortality is increasing in the United States. Though the rate of deaths that occur due to postpartum hemorrhage is decreasing, it remains the leading cause of maternal death. Approximately a third of maternal deaths and severe adverse maternal outcomes are the result of postpartum hemorrhage globally. A retrospective study using the data from the National Inpatient Sample Database from 2012 to 2013 calculated the incidence of postpartum hemorrhage in the United States to be approximately 3%. There are many risk factors for postpartum hemorrhage. However, the predictability of postpartum hemorrhage based on risk factors is very low, and thus we must focus on early recognition and treatment of postpartum hemorrhage. And still, we are not good at predicting hemorrhage. The definition of postpartum hemorrhage can be seen here and underwent a recent change in 2014. The shock index was first used and validated in the setting of trauma patients and was later validated in the field of obstetrics in the setting of first trimester ruptured ectopic pregnancies. In the term obstetric population, studies have suggested that there is a direct relationship between blood transfusion and an elevated shock index, or heart rate over systolic blood pressure, indicating that this may be a useful adjunct in early identification of postpartum hemorrhage. The shock index, heart rate over systolic blood pressure, has been demonstrated to be different in pregnant versus non-pregnant patients, with postpartum patients having an elevated shock index. One study found that shock index greater than 0.9 was adequate to identify postpartum hemorrhage patients in need of massive transfusion. Using a shock index of 0.9 as a threshold showed high sensitivity and negative predictive value, but low specificity for maternal death, severe end organ failure, ICU admission, and other adverse maternal outcomes. The current body of literature suggests that shock index may be a useful tool in early identification and thus facilitate earlier diagnosis and treatment of postpartum hemorrhage. Our study asked the question, can the shock index be used reliably as a predictor of patients who are at risk for having a postpartum hemorrhage? This study is a retrospective case control study based on cases of postpartum hemorrhage, which were full-term singleton pregnancies that were otherwise uncomplicated who underwent vaginal deliveries. The cases were matched for the following controls as seen on the slide, and specific inclusion and exclusion criteria were defined. Measurements of shock index were taken at 3 time points during labor and the latent phase, active phase, and second stage of labor. 2 methods were applied to develop the prediction model of postpartum hemorrhage using logistic regression. In the first model, one of the shock index measurements was chosen as the single best variable to represent the predictor. In the second approach, we made use of the change between subsequent shock index measurements as a predictor, or delta, or change of shock index over time. 2 methods were used to evaluate with respect to the model's predictive quality, explain variance and error under the curve. Potential confounding variables were adjusted in the models as listed here. Demographic and clinical data were compiled, and a significant value of 0.05 is used for the study. In the final analytical data set, there were 49 unique observations, of which 32 experienced postpartum hemorrhage. Controls were matched to cases on the variables in Table 1, and the comparison between postpartum hemorrhage group and control groups were presented here. It seems that the 2 groups were comparable in terms of demographics and clinical characteristics after matching, and similarly in Table 2, the clinical characteristics that were not matched between the 2 cases were specific to postpartum hemorrhage. In Table 3, we have a comparison between the heart rate, systolic blood pressure, and shock index between the 2 groups, and as you can see, there is no statistical significance between the 2 groups. To evaluate the predictive performance of each shock index in predicting postpartum hemorrhage, we calculated the value of the area under the receiving operating curve in 95th percent confidence interval, as shown in Table 4. The models predicting the dichotomous outcome of postpartum hemorrhage were analyzed using logistic regression. Shock index at admission and active labor and at delivery were used as separate predictors in a univariate regression analysis, respectively. The fourth and final method was to make use of the change between the measurements as predictors, including the first shock index and the subsequent changes in shock index measurement at active labor and at delivery. And Figure 1 visually presents the information of the area under the curve, and 2 presents the ROC model for the final model. The estimated area under the curve for the shock index at admission, active labor, and at delivery were 52%, 55%, and 57% respectively. And a area under the curve close to 1 indicates a better performing test, and when it is at 0.5, it means that the model is not able to separate class capacity. Based on the results, the first 3 models did not have much predictive capacity, taking into account the change between shock index measurements, which seems to be the best predictor at 58.8%. It still does not meet the suboptimal cutoff for performance at 0.7. The most limiting factor of this study is the small sample size of 49. It's limited due to the difficulty of identifying cases in the electronic medical record, and the majority of the data had to be compiled by significant chart review, which limited the speed at which data could be collected. The demographics and clinical characteristics of the subjects were well matched. The individual vital signs and shock index at each time point were not statistically significant between the hemorrhage and control groups. No individual time point was the best indicator. However, the change in shock index over the labor course has the most predictive value for postpartum hemorrhage based on the data set, but shock index does not seem to have a strong predictive value for postpartum hemorrhage patients overall in this low-risk population that we studied, and this may overall have limited clinical utility. It would be helpful to increase the sample size to further evaluate this, expedite extraction of the data, and focus specific groups for which shock index may be more predictive.